boxy waist, straight waist, no waist definition bothering you, you may be a candidate for a waist contouring procedure designed to create a smaller, more defined waistline and improve overall body proportions. Today, Dr. Raul Manzanada is ranking the most popular waist reduction approaches and telling us which ones actually work and which ones don't. Stay to the end because he's going to reveal a procedure that may completely change how patients think about creating a smaller, more refined waist. Welcome, Dr. Manzanada.
Thank you very much. Thank you very much. I'm very glad to stay here. Thank you.
Thank you. We're happy to have you on Beauty Seek. Rate on a scale of 1 to 10 how much this technique can actually improve waist definition. So weight loss alone on a scale of 1 to 10.
The waist loss, maybe the 110 is 2.
2. Why do you say that?
Because the waist loss is depend on the loss the visceral fat or maybe the loss the subcutaneous fat. But the waist depend on the other layers. No, the weight loss is maybe is 2 because is no treatment for the waist. It's treatment for the health.
Yeah. Okay. Weight loss is a 2. It's just weight loss overall. It's not concentrated on the waist.
Yes.
What about exercise overall?
The exercise is very important, the concept, because the exercise is the hypertrophy for the obliques muscles. I make the hypertrophy of the obliques muscle. I lost the waist because the hypertrophy of the muscle is the shape in the body is similar to the square because the shape of the waist depends on the obliques muscle. If the obliques muscle is hypertrophy in the patient, the athletic patient, the exercises is no improve the waist.
Really, that's sad. So, what would you give exercise on a 1 to 10?
No, it's improve your muscle, improve your fat, improve your health, but the waist, no, because it's the obliques muscle is the loss your waist. There are other technique is that take out the obliques muscle for the reshape the waist.
Okay. So core, what about just core training? Training your core where we're just doing sit-ups after sit-ups or training the core?
The core depends on the muscle. The rectus muscle is here and the obliques muscle is here. The hypertrophy that this muscle is no reshaping your waist. It's the athletic body, but it's no skinny waist.
Stay to the end because he's going to reveal a procedure that may completely change how patients think about creating a smaller, more refined waist. How much on a scale of 1 to 10 does genetics, what does that have to do with the shape of and size of your waist?
It's very important because in the other cultures, in the other part of the world, depending on the altitude, the altitude of the city, the chest is very wide. The name is the Andean thorax. The Andean thorax is published for me 3 years ago. Is the published research in the article, but is the patient live in the altitude city. The thorax is very wide. Okay, is the patient live around the sea is maybe it's a little thorax. There are different thorax, but depend the altitude, depend the genetic, depend the different factors.
Okay, 1 to 10, waist reduction, liposuction.
Liposuction is a 7.
7.
Yes. Liposuction is very good for the waist because in the waist there are a lot of fat. There are a superficial fat, deep fat, and deep fat. It's very important, the liposuction for the waist.
Stay to the end because he's going to reveal a procedure that may completely change how patients think about creating a smaller, more refined waist. What about hip proportion? Like if I got a BBL, would my waist look smaller because my booty's bigger?
It depends on the culture. It's not similar for the Europe, for the Latin America, for the USA. It's different. But the Fibonacci proportions, the name of Fibonacci proportion, the outer number is as 0.6. 0.6 is the ratio between the hip and the waist. Is the good proportion? Is the ratio?
Okay. So would a BBL, sometimes that would be too much booty for the waist?
Yes, it's in the BBL for the fat transfer in the hips. For indirectly, maybe the shape a little skinny waist, but it's not natural because the more is that it's not good. The people think about the large boot or bigger boots is the good buttocks. It's not really because the natural buttocks is the good buttocks.
I'm talking to a doctor tomorrow about reversing BBLs because there's that fat just gets bigger and bigger, and then it's going up the waist and down the leg. And so many women are reversing their BBLs.
Yes, yes. The BBL maybe is the good for the waist, but is not treatment for the waist. It's indirectly. Is that I augmenting the hip, but same the a little waist. Is this artifact? Is similar the artifact?
What about waist trainers or corsets? Can that give us a permanent waistline reduction?
There are a lot of treatment for the corsets for the reduction of the waist, but it's reversible. I take out the corset, the the edema, the atrophy of the muscles is reversible because it's the ribs, no the angulation of the ribs, no improve.
So, okay, how would you score skin tightening? Maybe after weight loss or pregnancy, can that improve waist contour?
Do you for tummy tuck?
Yeah, a tummy tuck.
Well, tummy tuck is very good because in tummy tuck there are application of the muscles. In the waist there are layers. The first layer is the skin. The second layer is the fat. The last layer is the muscles, the obliquous muscles. In the final part is the ribs. It's in the waist. The waist is between the ribs and the crest. This is the waist. Between the ribs and between the iliac crest bone. This part, the name is the waist.
So a tummy tuck, you would score
Or tummy tuck is the 8.
8? Okay,
Yep,
great.
yes.
I'm glad you brought up rib removal surgery. So that's definitely below the fat, below the muscle. What about removing ribs to create a smaller waistline? How would you score that?
My score for removal is 7.
7.
Rib removal is the good election for the waist. Is a treatment for the waist, but is there are a scar maybe 12 years ago is good treatment, but now the rib removal maybe at the world 3 or 4 doctors performing the surgery because it's the very non it's very dangerous. It's dangerous because it's the lost the protection for the chest. The ribs there are give the protection of the chest. The 12 ribs and the 11 ribs is around the kidney because if you take out the rib, if you little accident in this part, maybe damage the kidney. Is okay?
Okay.
Is that 7 for the score? But
Okay.
is very. Do you need that very carefully this surgery in this moment
Okay.
at the work?
That's good to know. So it's dangerous because you're not protecting your inner organs once you take out the ribs.
Yes.
Stay to the end because he's going to reveal a procedure that may completely change how patients think about creating a smaller, more refined waist. Let's move into what we're hearing more about now, rib remodeling. Tell me about that and give me your score there.
But the remodeling, it maybe is the ninth because it's the treatment is directly treatment for the waist. The rib remodeling is no rib removal; it's the angulation of the rib. The is the only the angulation. It's not traumatic fracture. It's the only the monocortical fracture. It's atraumatical. There are different. The traumatic and atraumatical fracture is similar to the rhinoplasty. In the rhinoplasty, there are a fracture here, but no the all the part. Is the only the superficial part of the bone. The name is the superficial cortical. Is the angulation of the bone. But in this moment, the rib remodeling is the good decision for the reduce your waist.
Dr. Raul Manzanada is going to reveal a procedure that may completely change how patients think about creating a smaller, more refined waist. Okay, let's dig into that a little bit more. You've developed a technique, and tell us what it's called and how you concepted it, and tell us about your techniques.
It's a new concept because this technique, the treatment of the body is only fat, only muscles, only tummy tuck. But with the rib scar is the first technique without incision. Is that the surgery time is 20 minutes. Is very safety. Do you need to stay in the Lima, for example, 10 days? There are protocols. There are the 24 police research. 4 years ago, I won the Best Cosmetic Paper Awards for rib scar in the PRS. PRS is the Plastic Reconstructive Surgery Journal. Is the most popular journal of the plastic surgery, scientific journal. It's very important because it's the best technique award for the reduce your waist. The name is the rib scar. Is the only is the with the machine. The name is the pisotome. The pisotome is the ultrasound machine. Is the little dots around the ribs for the angulation, a new angulation.
So a vibrating ultrasonic machine can actually reshape your ribs to give you a smaller waist.
Yes, it's the new concept. It's wonderful because before this surgery, there aren't a surgery reduce your waist 10 centimeters in 20 minutes.
And what's the recovery time look like?
The recovery time is depend. For the flight, is at 12 days. For the exercises, is 2 months. For the use the corset, is the 3 months. There are a specialty corset for this surgery. Is no corset for the gym. Is that corset specialty for this surgery. It's very important they no make the scars. The surgery is the boom of the work for the scars, without the scars. And maybe 10 years ago, the rib remodeling, there are scars 2 centimeters or 3 centimeters in the lower back. Now, there's without only punching, no scars, because that technique is a rib scar, rib, no scar.
It doesn't even seem possible. What were the scars like with rib removal?
The rib removal, no. This is a rib remodeling. No rib removal.
I know. I was just wondering what the scars were like for comparing it to rib removal. Were those big scars?
Yes, the rib removal, the scar is the 3 centimeters in the lateral part of the lower back. The rib remodeling 10 years ago is the scar maybe 2 centimeters in lateral part of the back. Now,
okay,
a rib scar is the without incisions, without a scalp. Don't use the scalp, only the sound.
So the surgical device is basically sound vibrating.
Yes,
and you are carving the ribs to
yes.
give a thinner waist.
That's amazing. It is not only for the ribs. They are in the anterior part of the chest for the wing ribs, the clavicles for the other doctor, for the other patient, maybe transgender patient, of the crest. The crest is the bone around the buttocks. Okay, this is the all the treatment for the body contour, the bone and the body contour. Is the new concept.
What are the risks with rib scar?
The risk of the rib scar, the first depend on the learning curve for the surgeon. Is no is no the all the plastic surgeon make the liposuction, but all the plastic surgeon don't make the rib scar because do you need the preparation, do you need the study the technique step by step for the avoid the complication. But the complication is the first complication maybe is the damage of the skin for the corset. The corset, if you don't use okay, maybe damage of the skin. The other complication, similar the burn, is not common. Other complications, same than pneumothorax or hemothorax, is not common. It's not common. But at the world, there are 7,000 cases of the rib scar for the doctors for my academy. 7,000 cases. But these 7,000 cases, there are two pneumothorax for the two patients, one in Argentina, other in Belgium. But the patient is the damage for the traumatic process, that damage for a traumatic process, same the automobilist accident. These two patients with an automobilist accident, 2 weeks after the surgery, have a pneumothorax, but only for the accident, not for the surgery. Okay, but do you need with the doctor? The learning curve is very important, but because it's the new surgery. In the resident school, don't study this surgery.
So you developed this procedure. Are you then training the doctors and they need to get certified through you for this procedure, or how does that work?
Yes, I have the academy, the arts aesthetic scientific expert. Is the 5 years ago the many techniques, the voluminization of the muscles, the tamitas. Now is the body contour treatment for the bone. In France, Japan, China, Marrakech, and all Latin America, there are doctors performing the rib scar. There are a website for the doctors practice good practice for the rib scar. Is the ACTS members, the names ACTS members. These are doctor certificates for the performing this surgery without complication.
What about in the US? Are there doctors in the US who are certified to perform this?
Yes, there are maybe 20 doctor certificates in USA.
20.
20.
How many doctors overall are certified?
305.
300. Okay. So if I wanted the rib scar surgery, what questions should I ask my doctor to make so I can be confident they know how to do this procedure as per your training?
The first, are you have a ultrasound? Don't exist rib scar without ultrasound. It's very important, the ultrasound. Okay. Second, there are the machine, the piezotomy machine with the tip for the ribs. The other is that all the surgeries in the certificate clinic for the plastic surgery certificate for the society in your country. Similar in Peru is the Peruvian Society certificate the rib scar training. It's very important. The ultrasound is the most important for the safety of the surgery. The ultrasound. The name for this surgery is rib remodeling without incision, ultrasound-guided.
Rib remodeling, ultrasound guided. I missed the middle.
Rib remodeling without incision.
Rib remodeling without incision.
Yes, with ultrasound
Gotcha.
guided.
What do you need a patient to come into this surgery with? Like, what does their health need to look like? What kind of tests do you do?
Is the bulk analytic same other surgery, but the plus is the bone densitometry. All the patient need before the surgery bone densitometry, because this surgery depends on the osteogenesis. If the osteogenesis is bad, the surgery is not performing, because the osteoporosis is the contraindication for this surgery. Osteoporosis, saying that no bone good health. DEXA scan, saying that DEXA scan, that need the CT scan before the surgery. Before a surgery, I need the bone densitometry. I need the cardiology evaluation. I need pneumology evaluation, anesthesiology evaluation, the analytic blood. Is that all the protocol?
Those sound important. How often do you have to turn a patient away because they just don't meet the minimum health requirements?
It not depend is there are a good man, young good man with a no good health, no good bone, but it's not depend the age, depend the bone densitometry. Maybe the patient that 20 years old is no good densitometry, but the patient that 15 years old is the good bone densitometry. Depend the analytic is the bone densitometry is very important, because the bone densitometry and analytic the healthy of your bones.
Tell me about some of the results. I mean, how much tinier can you make a waist?
There are I have a publication, the only rib scar, because the reduce your waist is different. The liposuction with rib scar or the alone rib scar is different. Okay, but the only rib scar performing reduce your waist between 4 centimeters and 20 centimeters. Depend on the measure of the ribs, depend on the measure of the rib 12, 11, 10, the ratio, depend on the skin, depend on the use the corset. If you want to avoid the complication, it's very important use the corset.
And that's for how long again?
2 or 3 months. But
2 or 3 months.
The most important is the first months. It's not necessary to match stretch. Is that there are protocols. There are new corsets for the clicks corset, similar BOA system. The BOA system is that the system of a ratchet, the clicks. One click is 0.20 millimeters. I need 1 centimeter for day. It's 4 clicks. Is stretched 1 centimeter. Is a new corset for this surgery.
So every day you're tightening the corset a little bit more?
Yes, depend on the corset, but the new corset is 1 centimeter per 1 millimeter for day. The other corset is 1 centimeter for week. But it's better that 1 millimeter for day, because I need the step by step stretch, no stretch too much in one step.
If a patient doesn't wear the corset, will they get the results they're looking for?
I make the surgery, I perform the surgery, is only the angulation. I need maintain this angulation with the corset. If you don't use the corset, this angulation is not maintained during for time.
Okay.
I need a corset for 2 months for the consolidation.
Tell me about one of your patients, maybe someone who is transitioning and they came to you, and what was their experience like with you?
It's wonderful, because many patients travel from Peru, make only this surgery. In this surgery, the time is 20 minutes. Maybe a patient, transgender patient, model patients, the models patient, because the no fat, no sagging of the skin, the body is square. It need a little angulation of the ribs is the good patient, because only little angulation is the reduce your waist maybe 8 centimeters. is that the models, the means, and the means for the transition or transgender, or the means with participate in the bodybuilders events, because with the ribs is around the latissimus dorsis muscle. I make the angulation the ribs. I performing. I improve this muscle.
I was wondering if you think before patients come to you for the surgery, what have they tried? Different types of procedures and weight loss and, core training, or are they now just meeting you and understanding and they come to you directly?
The patient go to my appointment is maybe for body contour, liposuction with rib scar is the most common. In the future, the rib scar is same the BBL. 2 months, 2 years. After 2 years, after 2 years in the all the work, rib scar is the same the BBL.
The same as BBL in terms of its effectiveness?
No. It's the same as that common. It's the very common surgery. BBL is very common surgery because the liposuction with the BBL is the common. The liposuction with the rib scar now in this moment maybe no, but in two years maybe that this surgery is very common at the world. In 2 years, this surgery is the augmenting the percentage that the surgery performing maybe 13% in 2 years.
Are you working on any techniques right now to continue to refine your approach, the lipo and rib scar?
It depends on for the patient, but the patient is too much fat is need the combination the liposuction with the rib scar. The patient sagging of the skin need the tummy tuck with the liposuction with the rib scar. It's different parts of the body. I make the skin with a tummy tuck. I performing the fat with a liposuction. I performing the muscle with the plicature in the tummy tuck. But the bone is not treatment 3 years ago or 4 years ago. Now in the body contour treatment is the rib scar.
Fantastic. Great.
I repeat, it's very important the curving layer from the surgery because the other surgery, no training for the rib scar training. The performing with surgery only see the video, only watch the video. It's no good because that you need the learning curve. This surgery is different other surgery. It's not liposuction, it's not tummy tuck, it's different. You need a perception, you need the practice.
How much practice do you think a surgeon needs? How many procedures should they have executed before you feel like they're competent?
First, with the animal practice in the university. The second is the cadaveric dissection in the university. After this, the 2 or 3 cadaveric dissection is the performing with the patient. But the first surgery is very important with doctor performing the surgery, because it's very important the first surgery with the doctors is need that wash the surgery, because it's the different other surgery. Maybe at 10 patients, 10 at 20 patients.
Okay, so that's a critical question a patient should be asking is, how many surgeries have you performed with the rib scar technique? Yes, how many have you performed?
320 cases.
Okay, so you're an expert.
But at the world is that 7,000 cases for the rib scar.
It is amazing. And I'm really happy for anyone who's really gone through maybe some of the other techniques and they just haven't been able to get that definition. You're a gift. I love this. Some approaches may slightly improve the waist. Others can create bigger changes, but with more invasive surgery, larger scars, and longer recovery. But now, newer scar minimizing rib remodeling procedures like rib scar, the technique that Dr. Manzanada has spent years refining, are changing how surgeons think about creating a smaller, more defined waist. Dr.
Yeah.
Manzanada, thank you so much. You are a gift. Beauty seekers everywhere will be so happy to be learning about this procedure that you basically invented.
Yes, thank you very much. But the rib scar is the most common surgery in Lima, in my country.
Can we just talk about the tool just for a little bit? Because it sounds like without this tool, this wouldn't be possible.
Yes, it's impossible without tools. There are. It's very important the piezotomy. The very important tip for the Manzanera tools is the name. Is that a new tip for the piezotomy because the piezotomy is the machine for odontology machine. Is the new tip for the body contour. The rib scar is the first rib remodeling without incision. No incision is the first surgery, and maybe 2 years, 3 years is the advanced the technology is the other machines. But now is the rib remodeling is same the rib scar.
I love that. And how did you come up with the original idea? Was this like you woke up and you had a dream or?
The idea is the first I work in the children hospital when I make my residence, there are surgery. The brain surgery is the microtia is when the patient born without ear. Okay, the child. The reconstruction is with the cartilage of the ribs. The reconstruction of the ear is that with the cartilage of the rib. This surgery performing the new ear. You know,
Yeah.
yeah, the name is the brain surgery. This surgery is the first surgery I make for the chest. Second, I make maybe for 2 years rib removal. Okay. After is the rib remodeling, but without incision, with incision, maybe 2 or 3 centimeters. But now is the only the needle because the 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 ideal surgery is without incision, without a scar. Is saying the lifting, saying the blepharoplasty. The ideal surgery is without scar. Is the finally for this surgery is the rib scar is without scars. This is the finally but this surgery. But it's not dream. But there are a magic trick without banana around the needle. Put the needle around it without incision. Open the banana. Maybe the is the part of the banana. It's similar the trick of magic, but is the process. Is the process. Is the work for 5 years. The authors is not only I. It's the doctor. I first author, but the other doctors, Dr. Hector Duran from Mexico, Doctora Laura Cala from Colombia, is Dr. Emmanuel Flores from Mexico. There are other doctors performing this surgery. The original articles.
Okay, so you were collaborating with them, but that's fascinating. You were working on children's ears, taking their ribs to reformat their ears, and then there was a click moment when you were doing rib surgery.
Yes.
Oh my goodness gracious, that's amazing.
Thank you.
So this is like your life's work. This is a major accomplishment in your life.
This is my life work. Yes.
I love that. Some approaches may slightly improve the waist. Others can create bigger changes, but with more invasive surgery, larger scars, and longer recovery. But now, newer scar minimizing rib remodeling procedures like rib scar, the technique that Dr. Manzanada has spent years refining, are changing how surgeons think about creating a smaller, more defined waist.